Okay, so hello everyone. My name is Miss Sam. I am one of the teen librarians here at the Levittown Public Library. And today we are honored to have Mary Jane Mortensen, who is a nurse in Colorado at the Rocky Mountain Hospital for Children. And we are honored to have you today to kind of talk to us about what it's like being a nurse and how you got there. So I want to say thank you for participating and for being here today. And I'm going to turn it over to you, Mary Jane. Why don't you tell us a little bit about yourself and how you got to where you are today?
All right. Well, of course, thank you again for having me. This is a great opportunity. I don't mind talking about my job at all. So again, my name is Mary Jane. I've been a nurse for about 4 years now. Um, I have started my nursing career in the endoscopy field, which is, not the most glamorous portion of nursing, is so people say where you do colonoscopies and EGDs and all that kind of stuff. But it's all surgical nursing, and I've really enjoyed it. I started in Utah 4 years ago, right out of nursing school. A couple years later, I decided to move to Colorado, and I started doing pediatric pre-op and PACU. So I work a lot with kids, and as they're getting ready for surgeries and all that kind of stuff. I did go to nursing school in Utah. It took me a few years to get through nursing school. Our program was 3 years long, but it was a really great opportunity. I've loved every minute of it so far. I think what kind of got me into nursing was I just the need to help people. I kind of flirted with the idea of the medical field for quite some time. Growing up, I couldn't decide if I wanted to be maybe a pediatrician or if I wanted to go be a physician assistant instead, but I really settled into nursing because they have the most like patient contact. But yeah, so that's kind of me in a nutshell right now.
Great. And then can you talk? I know you said that you went to nursing school and it took you about 3 years. Would you say that that's kind of the typical length for a nursing program? And how did you have to apply specifically to be in the nursing program, that part of that school, or what did you just apply to the general school? Can you talk a little bit about how you got basically into the nursing school?
Sure. So I actually started at a different university. I had started prerequisites for nursing school there. After a couple years is when you're supposed to apply for nursing school, and I decided to apply to a couple different places. I got into a private school for nursing. And their program specifically is a year longer than the typical nursing school, just because they spend a lot of time specifically with like ICU and psychology and all that kind of stuff that a lot of schools don't necessarily focus on as much. So my schooling was just a year longer than the typical nursing school. So usually they're about 2 years. You can do like accelerated programs where you can get nursing school done in 18 months. There's also different options where you can start nursing school right as you're starting college and get your associate's RN and then complete your bachelor's later on. So there's so many different options you could do for nursing. I myself have my bachelor's. It took me about 5 years or so to go ahead and get that.
Nice. And then I know with nursing, there's a bunch of different paths educationally that you can take. So I know you said you could have your associate's degree, you can get your bachelor's degree. I know some that could even go further than that. So what would you say are some of the benefits of continuing your education past an associate's degree? Do you think it was worth it? Are there certain benefits that come with that going further?
Definitely. I know that sometimes bachelor nurses tend to get paid a little bit more. And in the hospital field right now, ever since I started nursing, there's been a push for people to hire bachelor degrees over associate degrees. And in fact, they have made a pact with a lot of the nurses that are already in the hospital who only have their associate's degrees to get their bachelor's by a certain time. So they're really pushing for that bachelor's more than the associates. Needless to say, you can still get a nursing job as an associate level nurse, but they do prefer the bachelor over that.
Gotcha. So definitely something to just think about. And then obviously we talk about within the medical field, obviously with nursing, there's a bunch of different fields that specializations that you can go into. So I guess the question then comes is once you've gone into nursing school, is there just one degree that you get? Do you need a license for each specific, specialization, or how does that work?
So what's great about nursing is that you're trained in every single field. So if you wanted to go to pediatrics, you can after you graduate, or if you decide you want to change your route and go deliver babies, you're more than welcome to. There is a license that you do have to get. So after you complete your nursing school portion, you have to go and take the NCLEX, which is the nationalized examination for this. Kind of a scary test. Sometimes it's computerized. It kind of learns you as you go. The more questions you get right, the harder it gets, kind of a situation. Um, but after you get your license, you can honestly choose any field that you want. And then once you're in that field, you always have the option to get certified to become like more specialized within your care. So like for me, I work in pediatrics in the OR, and I can go and get my CPN, which is a certified pediatric nurse that shows all individuals, managers, all that kind of people that I really know my stuff with pediatrics.
Gotcha. And then obviously we talked about licensing within the state. So obviously, if somebody is interested in moving from state to state, how does that work? Is it easy to switch from state to state or region to region? Are there additional tests, or obviously, I'm sure each place has their own licensing requirements. So how does that work?
So nursing is very special. We have something in the US called the compact state. So if you happen to pass your NCLEX and get licensed in one of those states, I think there's like 34 or 38 states or something that is part of this compact. As long as you pass NCLEX in one of those states, you're able to move freely from state to state fairly easily. There's just like maybe a $40 fee or something just to update your license. However, needless to say, it's not hard to get your license in a different state that's outside of the compact. It's just a higher fee. There's no tests or anything like that involved. It's also possible to even travel outside of the country, but outside of the country, usually they require you to take their version of the NCLEX. So there is testing to be able to leave the country to do nursing.
Gotcha. Okay, great. And then I guess another question that I always had too was, obviously nurses can work in a variety of different settings. So can you give us a little bit about what kind of the difference is between working in say a hospital setting versus like an office setting or something like that? And what are the benefits or drawbacks to either one?
Sure. And I have experience in quite a few different places. So I used to work in called an outpatient setting. That can be your clinics. Those can be just like your outpatient surgery centers. And I've also worked in the hospital as well, doing inpatient kind of stuff where people have been admitted to the hospital and they're there for an extended amount of time. The big difference is honestly your work hours. In outpatient settings, you're usually working either 5 8-hour days or 4 10-hour days, whereas in the hospital, you're working 3 12-hour days. In outpatient settings, you very rarely have to work weekends and holidays. Usually the places are closed, whereas in the hospital, you're going to have to alternate weekends and nights, all that kind of stuff. So the hours are the biggest thing. In an inpatient setting, you're more likely to see the same patients over and over and over again. You could be with a set of like 4 to 5 patients for 12 hours one day, and then the next day you come to work, you still see those patients. Whereas in an outpatient setting, again, because it's surgical or whatnot, you're getting a new patient every hour, hour and a half, and you hang out with them for that time. You get to know them for a little bit, and then they're gone, and you just kind of meet a lot of people that way.
Yeah. Awesome. And then let's kind of go through kind of your general day to day. So what would your typical day would look like? Obviously in nursing and medicine in general, I would think that it would be very different from day to day. But is there anything that is consistent or anything that you feel that you need to be prepared for each day?
So I work in a pre-op and a recovery setting in the hospital for kids going in for surgery. A lot of what happens in the morning when you come in, there's something called a huddle. We get together with all of the staff members that are there today, as well as our charge nurse and sometimes our manager. They kind of go through what our day is going to look like, how many patients we're going to see, what kind of surgeries are happening. They kind of update us on policy changes or things that are new to the department, whether that be new equipment or new employees or people coming to visit, anything like that. Then we usually kind of break and we go and check our individual rooms that we're going to be in to make sure that we have all of our emergency equipment, everything that's ready for the patient to come in. And then because we do have kids, we do check in. We have people called child life specialists in our hospital who come in and make children more comfortable, because surgery is a really scary thing for little kids. And we just make sure that there are toys available, everything's clean, everything's ready for these children to feel safe and happy and comfortable in the hospital. We will get them ready for surgery. We'll get them dressed, go through like their medical history, what medications they're taking. Sometimes on the older kids, we need to place IVs and do other little special things like give medications and stuff. When they come out from surgery, that's when we watch them to make sure that they are waking up safely. They're usually with us for about an hour and a half. And then we could do anything from pain management to just sitting there and hanging out with them. We could end up holding babies for parents while they're busy. We could be playing games. We usually put movies on just so that they're comfortable up until the point that they leave. And then we just kind of keep rotating patients out until the day's done.
Nice. Very cool. And then would you say that there are any limits? I know we talked about a little bit about how the schedules can change varied, depending on whether you're in the hospital or whether you're in a more office setting. So would you say that there's any limitations to your personal or social life that teens should be aware of if this is a career that they're considering?
I mean, if you're working in an inpatient setting, it might affect you a little bit with like if you're having to do night shifts and you're going to have to rotate weekends and holidays. I'm very fortunate where in the field that I currently work in, I work maybe 2 holidays a year and it's only for like 6-hour shifts. So it's not very long at all. Like 4th of July, I worked 6 hours and then I was still able to go home and watch the fireworks and everything. So my specific job, I feel like there's no limitation. I get to schedule my days out in like a couple months in advance. So if I want a 3-day, 4-day, 5-day weekend, I have that flexibility to make sure that I get that. So it kind of just really depends on what field of nursing you're going into. Surgical nursing is what we call the best kept secret because it's really more flexible than a lot of other nursing fields are.
That's very nice. Yeah. And then how much do you say that you travel a lot for your job, or do you say, are you pretty much in the one setting? I mean, you're at the hospital day in and day out, or do you do any traveling at all?
So I never really traveled to other hospitals. I'm always in my home hospital, but because I've been trained in other specialties, if their need arises and they're low staffed in another department, we get what we call floated to the other department just to help out for the day. But more than usual, I'm always in my home department. It's very rare that I go anywhere else.
Gotcha. And then I always talk with the teens too about working in team settings or working individually. So I would think that in the medical field, it would be safe to say that you're more working in teams than you are individually. Could you talk a little bit about that? I mean, how important is it to be able to work in a team?
I mean, teamwork is super important in nursing. If it was an individual job, I would say that it would be a miserable job. You're working with so many personalities, so many people. You've got the doctor, the PAs, the NPs, the RTs, the pharmacists, not to mention the CNAs and the techs and the patients themselves. And everybody is making so many different medical decisions for this one patient. You really have to be able to learn to communicate and work together in order to create the best care for this certain patient. One person that decides to go rogue or decides to not be a team player really can screw up care for an individual. And then in the department itself, sometimes it gets really busy and overworked and you're struggling sometimes like, hey, I'm watching this patient, but that one really needs to go to the bathroom, but I can't leave. It's very important to have a good rapport with all of your coworkers so that they're able to be like, hey, I'm free. Let me take your patient to the bathroom while you're busy, kind of a situation. So teamwork is like utmost importance in the medical field.
Definitely, definitely. And then that actually leads nicely into my next question is, what would you say are some of the interests, abilities, or skills that are important for somebody to be successful in your kind of work? Whether personality traits or just things in general.
Well, I would have to say the most important thing is you can't be scared of blood and guts and all that kind of stuff. Nurses have to place IVs on a daily basis. There's a lot of personal care when it comes to bathing and dressing changes and cleaning up wounds and all that kind of stuff. So it's very important to realize that you have to have a strong stomach. Also, compassion is a huge one because a lot of these patients come in and they're terrified and they're scared. They don't want bad news, and being able to empathize with them and being like, yes, you're right. This is a really scary situation, but I'm here to help you. They need nothing but care and kindness. things to kind of focus on is, I mean, you need to know science, you need to know math, you got to be really good at those stuff. Otherwise, if by chance a doctor orders the wrong medication and you don't catch it, that could also harm your patient. So being really knowledgeable in your sciences and everything is very important too.
Great. And then also we've been talking a lot about technology, especially during this last year with the with the influx of Zoom calls and things like that. So could you talk a little bit about how technology has changed in your field? Is there anything that you see coming up that teens should be aware of that maybe they could start working on some technology skills even before they get into that field?
So the biggest part of a nurse's job is charting. Charting is super important. So being able to really effectively use the computer and be able to open up all these different systems and make sure that you know what you're looking for, that's a big thing. Unfortunately, charting systems you won't get much experience with until you're actually in the field. But there's also like the telehealth. That's been a new thing since COVID started. So getting comfortable using the screen, like me, myself, because I've been in the hospital all this time, Zoom calls are very foreign to me. So it's interesting, whereas if I was working in a clinic, they do a lot of telehealth. And like, for example, I got bit by an animal once during Zoom, and I was showing somebody like my bite mark over the phone call. And it was just so interesting to me. So being able to be personable and understanding how to be comfortable in front of the camera sometimes is really important, especially with the telehealth. I can definitely see that being more popular as time goes on. I think a lot of people are very comfortable to talk to the doctor in the comfort of their own home rather than going into a clinic.
Yeah, definitely.
And then, of course, there's always advances in medicine. There's always things that are always ever changing. Surgeries are getting better, medicine's getting better, all that kind of stuff. So just being able to adapt and being willing to change and re-educate yourself, because you might learn something in nursing school that's going to be completely different 10 years down the line, and just being able to jump in and understand that new information is always going to be coming at you.
And that actually very nicely leads into my next question too, is obviously medicine changes every day. I mean, it's a very fast growing field. So how do you guys stay on top of, skills and as technology is changing, as medication is changing, do you take continuing education credits and things like that? Is that something, obviously nursing school kind of never ends, like you're continuing to brush up on skills, but how does that go specifically for you?
So we are always learning new things. We do get assigned online education. So it is continuing education. We call them CEs, in order to keep ourselves updated on the new changes in the medical field. We usually get them monthly, quarterly, yearly, just to make sure that we are up to date with everything that's new. We use a lot of evidence-based practices, and we get a lot of information through emails and everything, just to make sure that we know all the changes that are happening. Through COVID, that was the big one, because when COVID first started, none of us really knew how it was working, and every day we were getting new information. It's like, hey, now we're wearing masks, hey, now we're wearing goggles, hey, now we're wearing gowns. It's just being able to flow with that kind of information. But yeah, no, we do a lot of CEs, and nursing is actually, there's a requirement in a lot of states to make sure that you're up to date with these CEs in order to keep your license up to date as well.
Gotcha. And then if what is something that teens could be doing now if this was a field that they were interested in pursuing eventually? Are there opportunities for internships, for summer jobs, for extracurricular activities that they should be looking into if this is a field that they're interested in?
So a lot of nursing schools really like volunteer hours. It doesn't have to be in a hospital. Just showing that you're out there working with the community in general is really big. So volunteering, it could be anything from working in soup kitchens to helping in schools and tutoring and all that kind of stuff. Something else that's important, I'd say, like not necessarily internships or anything. It's really hard to just jump into the hospital without being properly trained, but there are jobs that you can get that definitely look a lot better on your resume than just say working at an ice cream shop or something. If you get like your CNA license, which usually only takes I think a few weeks, and working as a CNA in the hospital field, doing a shift here and there, getting clinical experience that way is really helpful too. And then you can get volunteer work jobs in the hospital too. You can transport patients, be an orderly, you can be a front desk reader. Anything that kind of gets you through that front door is really helpful.
Great. And that actually leads into my another question too, which is once you're out of nursing school, how do you go about finding that first job? Is it something that you need to go through like an agency? Is it through listservs? Are you looking and contacting hospitals and clinics on your own? How does that process work?
So what's really great at the end of your nursing school career, the last semester, we do something called a capstone or an externship. You are placed in a hospital on a unit where you learn to be a nurse completely solo on your own in that specific department, and you're there for the entire term. A lot of the times you end up getting hired into that department. So a lot of people will tend to choose where they want their capstone to be, because that's where they're going to end up in their career. But needless to say, that doesn't always happen. Like my capstone was in bone marrow transplant, and I obviously didn't end up in bone marrow transplant. After I did get offered a job there, I decided, you know what, it's not for me. And there are so many different ways to look for jobs. You can go to hospital websites and scroll down to the bottom of the page and go explore careers. You can go on Indeed. You can go on like any of those job hunting websites, and they post everything from what kind of nurses they need, how much experience they need, and all that kind of stuff. So it's very easy to look up nursing jobs.
Nice. And what would you say? Would you say that this is a fast-growing field, that the need for nurses is always growing, or do you think how does the job market look in the future?
It looks really good right now. There is definitely a huge need for nurses. There's been a kind of a big mass exodus of nurses since COVID started. And then there's also the baby boomer generation that's going to be retiring here in a few years, which makes up a large portion of our nursing population. So we're already seeing shortages for nurses like in every single department. So it's very easy to get a job as a nurse because there's such a high demand for it.
That's awesome. And then also I wanted to ask you about too is opportunities for advancement. Obviously, we talked a little bit about associate's degree versus bachelor's degree. Are there other ways to advance within the field of nursing? Is it based solely on education and experience, or how does that work?
So there are definitely very many different kind of ways to be able to advance your career. If you don't want to get more education, that's fine. You can still work within your department, within your means. You can become a charge nurse. You become a manager. You don't need extra education to get that. It's liked, but it's not necessary. However, if you want to move away and get more education, there's so much you can do. You can get like a nurse education degree with your master's. You can get a master's in nurse practitioning, a doctorate, a PhD. You can even completely leave bedside nursing and decide to go health administration or business administration and become the CEO of a hospital if you really want. And then nursing actually qualifies for a lot of the prerequisites needed for other jobs like public health or anything like that. So there's so many different options you can do with a nursing degree. You can go back to medical school. You can go get your PA. There's so many things.
I mean, that's kind of what I think is the greatest thing about nursing is that there are so many different options, so many different fields that you can go into, and it can also be a great stepping stone into, even different careers. So definitely many options. So that's great. And I guess my very last question then would just be do you have any advice or words of wisdom for teens that may be considering going into this field? Any last minute thoughts?
Yes. So getting into the nursing field is very daunting, especially when you're in nursing school and you have what's called preceptors. They're nurses that watch you throughout the day while you're working in clinic and on the floor and everything. Knowing that sometimes nurses can be mean, but they don't necessarily mean it. It's kind of a cutthroat kind of job at the beginning, but when you get into it, it's not bad. And you learn so much on the job. It's not like you have to learn absolutely everything in nursing school. Nursing school information is very important, but you learn so much while you're out there in the field itself. And just remembering that you need to be kind to yourself, kind to your other nurses, and kind to your patients, because everyone is there for a reason. Everyone wants to help and be helped, and kindness can go so far.
That's amazing. Well, I just wanted to say thank you so much for taking time out of your very busy day. We really appreciate you being here and sharing all of this amazing knowledge with us. And, we really do appreciate your time. Thank you so much.
Thank you.